Just in terms of all those commemorations and activities on today being Mandela Day, Gauteng Health, on the other hand, has set quite an ambitious target of 700 surgeries for today being Mandela Day, and they will be performed at 32 hospitals around the province. All the patients come from the backlog list of each hospital, and the move is aimed at addressing severe backlogs at these facilities. My colleague eNCA's Heidi Giokos is finding out if this can actually be done for Mandela Day, and why not every single day. She joins me now for this update. And Heidi, good morning to you, colleague. Let's talk about this ambitious target here set by Gauteng Health.
Yes, certainly. I think it's a great initiative for Mandela Day, 67 minutes. We do know that there is, of course, a massive backlog when it comes to surgeries in the Gauteng province, specifically 18,000 patients awaiting surgical procedures. This will be reduced from 32,000 at the beginning of the year. So the Gauteng Health Department is, of course, at pains to really try and get to that massive backlog. We do understand that it's going to be across a number of hospitals here in Gauteng. We also do know that the MEC for Health will be in attendance today and will of course get further clarity as to what exactly these surgeries entail. But it's not just for Nelson Mandela Day today, Tumelo. I think it's important to emphasize the fact that the Health MEC in the province has really tried to emphasize the fact that she has been at pains to try and get to this massive surgical backlog. Contributing to this, of course, was the major issue of the COVID-19 pandemic, where non-important or essential surgeries were not really prioritized because of what was happening with the COVID-19 pandemic. So there is, of course, that massive backlog, and what better way to celebrate Nelson Mandela Day by really giving opportunities to patients to try and deal with this massive backlog. There's a huge target that has been set for today, so we'll just have to get details from the MEC as to how exactly this is going to work. And I think it will be great if we can also speak to some of the surgeons around what kind of surgeries are going to be taking place and how they're going to manage to conduct these 700 surgeries in the province for Nelson Mandela Day. So we'll, of course, get those details. We do know that the MEC is on her way, if I'm not mistaken, so we'll get further clarity on that.
Absolutely. And I suppose today, Heidi, in as much as we understand it's quite an ambitious target to set here, hopefully it will set precedents for moving forward in terms of addressing backlogs, medical conditions, affecting a lot of patients. And we know that backlog lists in hospitals, especially government hospitals, have only been increasing. So hopefully this could really set the precedents moving forward. And it's not really a one-day event.
Certainly, I think it's an important point you touch on, Tumelo, the fact that we do know that the state of health in the Gauteng province has been in the spotlight. There have been a number of issues. You've had patients emphasizing the fact that sometimes they aren't treated fairly or they don't get the attention that they need. Again, the MEC of Health has really tried to turn around a number of hospitals. Steve Biko Academic Hospital being a very big hospital that, of course, caters to a number of patients. So this is perhaps just the stepping stone for the Gauteng Health Department to really get to the bottom of this massive surgical backlog that we are seeing. You've seen patients saying they've been waiting months, years to get in line to be operated on, whatever it might be, a hip replacement or eye surgery or whatever the case might be. So it's going to be critical for the Gauteng Health Department not to just use the 67 minutes or Nelson Mandela Day to get to the bottom of this massive backlog. If you look at 18,000 surgeries that still need to happen, they have a very long way to go. How they are going to do this is going to be critical, and who they are going to prioritize is, of course, also going to be very important. But we'll get more clarity from the MEC when she arrives in a short while.